You are having a counseling and shared decision-making visit because one of your caregivers has referred you to the lung cancer screening program. Screening is performed at our main campus and at sites throughout the Cleveland Clinic Health System. You are here because we want to educate you about the potential benefits and harms of lung cancer screening. We want to help you make a decision that is in keeping with your values about whether you should be screened. Cancer is the second leading cause of death in the United States, just behind heart disease. Lung cancer is the second most common cancer in the United States, after prostate cancer in men and breast cancer in women. More people die of lung cancer than from prostate, breast, and colon cancers combined. This is probably because lung cancer is often found late in its course when treatment is not as successful. Lung cancer often has no early signs or symptoms. Some patients may have a nagging cough or shortness of breath. Late signs include losing a great deal of weight unintentionally, coughing up blood, unexplained chest pain, and cough or shortness of breath that gets worse. A screening is a medical evaluation that is used to find a disease or to see if someone is at risk of developing a disease or being harmed. Screenings are performed in a group of people who have a greater risk of developing that disease. Examples include colonoscopies for colon cancer or mammograms for breast cancer. Screenings are different from other medical tests because they are performed on people who do not have symptoms or signs of the disease and seem to be in good health. Only a small percentage of people who are screened for a disease are actually found to have that disease. Lung cancer screening is a program and not just a medical test. The lung cancer screening program includes counseling and the shared decision-making visit, the screening low-dose CT scan, management of the test findings, and a program to help those who still smoke to quit. Lung cancer screening uses a low radiation dose computed tomography or low-dose CT of your chest, which provides detailed images of your lungs. The goal of lung cancer screening is to have fewer people die from lung cancer by finding it at an early stage when a cure is possible. Lung cancer screening is recommended for people who are considered more likely to benefit than be harmed by screening. We offer screening to those who are at high risk of having lung cancer and for whom the benefits of screening would outweigh the risks. The following conditions should be screened for lung cancer: between the ages of 50 and 77 years old, have smoked at least 20 pack years. In other words, have smoked 1 pack of cigarettes a day for 20 years. Have smoked within the past 15 years. Have no signs or symptoms of lung cancer. And are healthy enough to tolerate and benefit from treatment for lung cancer. Approximately 1 in 100 people a year who meet these criteria and have a screening is found to have a lung cancer. After having a screening every year for 3 years, approximately 1 in 300 people screened will have avoided dying of lung cancer. As with any medical procedure, there are some downsides to lung cancer screening. Many people who are screened for lung cancer will have nodules, which are small spots within the lungs. More than 95% of these nodules are not cancer, but are simply a small scar. Medical professionals will analyze the nodules to determine how likely it is that they are cancer. Some nodules may look like a cancer on the low-dose CT imaging, but the only way to know for certain is to perform a biopsy and look at the cells under a microscope. Therefore, there will be times that we would recommend an invasive procedure such as a biopsy or surgery for a nodule that looks like a cancer, but may not actually be a cancer. Possible problems related to seeing lung nodules on the low-dose CT include finding and evaluating nodules that are or are not cancerous, anxiety at the thought of having a nodule in the lungs, Performing biopsies for nodules that are not cancerous. This happens in approximately 1 or 2 out of 100 people who are screened. Major complications that can occur during any invasive procedure like a biopsy. These occur in 1 or 2 out of 100 invasive procedures. Overdiagnosis and overtreatment, finding, evaluating, and treating a growing cancer that may not have harmed you if it had never been discovered. The radiation exposure from a low-dose CT is very low. One low-dose CT is approximately equivalent to 15 X-rays, 50 cross-country flights, or 6 months of natural background radiation. In order for a lung cancer screening to be successful, patients should return every year for a low-dose CT. This means you would be having numerous CTs over several years, so the dose of radiation will add up over this time period. The risk to your health from this radiation is not known, but most experts feel it is very, very low. In addition to taking images of your lungs, the low-dose CT will also take images of the following areas in your body: the structures in your neck and heart, surrounding blood vessels, the organs in your upper abdomen, the chest wall, and other muscles and bones. During these tests, there is a chance that something else inside or outside your lungs may be found. This is called an incidental finding. Incidental findings are medical conditions that are discovered while looking for something else. These conditions may not be related to the current condition that is being treated or screened for. Common incidental findings that are found during a low-dose CT scan include coronary artery hardening, thyroid nodules, adrenal gland nodules, and enlarged lymph nodes. If one of these findings appears on your low-dose CT, your screening team will advise you on whether it needs further evaluation and will connect you to the appropriate team if it does. If you choose to be screened, you will have a low radiation dose chest CT scan. During this scan, you will lie on your back on a table that moves you through a large opening in a machine. The machine takes detailed X-rays of your chest. You will be asked to hold your breath for 5 to 10 seconds during the test. The provider you meet with will share the results of the scan with you soon after they are available, which is usually within a week. If there are no findings that need follow-up, you will be scheduled to have your next screening visit and scan in 1 year. If there are findings that need to be evaluated further, your provider will discuss them with you and will help to arrange for any additional tests or visits that are needed. If you are a smoker, your provider will also talk to you about quitting smoking and will help you quit when you are ready.